Welcome back. We are talking with Dr. Alero on Fauza's diary, and the topic is diabetic. She has already been with me in different timings on the same topic, but today we are diving in deeper because January is the month that insulin was discovered, right? And Dr. Alero has been sharing with us her knowledge in this topic. We are now in part 2 of this conversation. If you haven't listened or had time to watch part 1 and even the previous conversation that I had with her, I would love to encourage you to go back and listen so that you don't miss the dots, because the dots will only connect when you look backwards. So I'll want to have you to go back and have a look on that. Right. Welcome back, Dr. Alero. And thank you so much for sharing a lot already, but I would like for us to talk about diabetics today. What are the different types of diabetes today?
Okay, so we have several types of diabetes. If you meet someone who has diabetes, the likelihood is that they will have type 2 diabetes or type 1 diabetes. Type 2 diabetes is mainly related to fat. So if you have a lot of fat in your body, this will increase your body's resistance to the insulin that comes from the pancreas. And then this causes your sugar levels to go up. So type 2 is the one that you probably hear about mostly in the media. It's related to lifestyle. Maybe if you're sitting down a lot, you have a sedentary lifestyle. But it's mainly related to fat, although not everyone who has type 2 diabetes will be overweight or obese. You will have some people who just have a genetic susceptibility to diabetes. So maybe they have a parent or a sibling that has type 2 diabetes, and that's why they've got it. So type 2 diabetes is your pancreas, which is a small organ that sits behind the liver, it produces insulin. In type 2 diabetes, you are still able to produce insulin, but your body doesn't react to it as well as it should, because maybe you have a lot of fat and that's causing your body to be resistant. Then we have type 1 diabetes. Type 1 diabetes is traditionally the diabetes that affects children, but we now know that anyone can be affected by type 1 diabetes at any time. Now, the thing with type 1 diabetes is that your pancreas is not producing any insulin. Something has happened to the pancreas and it stopped producing insulin. So people with type 1 diabetes, they need insulin injections for the rest of their lives. They can't control it with diet. They can't control it with exercise. They need insulin, otherwise they will be very unwell and may die. So this is type 1 diabetes. And that's not related to your weight or anything. In fact, we still don't really know why people get type 1 diabetes. We know that it affects people from the northern hemisphere more than people from the southern hemisphere. We also know that if you have a parent who has type 1 diabetes, you have a slightly higher risk than the background population of getting type 1 diabetes. Type 2 diabetes, we know, is related to lifestyle. So that can be treated by changing your lifestyle. If you're obese, losing weight, exercising, being careful with your diet. And then we can also treat it with tablets. Sometimes people with type 2 diabetes will need insulin if it's advanced or if they've had it for many years and the pancreas is just struggling. They will also need insulin. So those are the main types of diabetes. Then I should also mention gestational diabetes, which is diabetes that happens in pregnancy.
Okay.
Yes, so you get some women who get diabetes in pregnancy. And many women out there will remember that whilst they were pregnant, at about 24, 28 weeks of pregnancy, their doctors asked them to do a sugar test where they had to drink the glucose, and then they tested them to see if they had diabetes. So this is what they were looking for. They were looking for gestational diabetes. Again, gestational diabetes can happen to anyone, but we know it tends to happen to people who are older in pregnancy. So if you're pregnant and you're over 35 or over 40, you'll be more at risk of getting gestational diabetes. People of certain ethnic backgrounds, so if you're Asian or Black or Arab, you'd be more at risk of getting gestational diabetes. If you have someone in your family that has diabetes, especially type 2 diabetes, you would be more at risk. If you have a multiple pregnancy, like maybe you have twins or triplets, you'd be more likely to get gestational diabetes. And the reason this occurs is as the placenta gets bigger.
Yeah. That's what actually I wanted to ask. I was like, okay, what is the cause of that?
Yes. So, I mean, these women usually have a susceptibility to diabetes anyway. They've got a family history or something. But then in pregnancy, as the placenta gets bigger, as the baby gets bigger, the placenta gets bigger.
Mm-hmm.
And this placenta releases all sorts of hormones that make the body more resistant. So similar to the fat in type 2 diabetes that makes the body resistant, in pregnancy, it's the placenta and the hormones it's releasing make the body more resistant to the insulin.
Right.
And then they develop diabetes, gestational diabetes.
Okay.
So in pregnancy, the gestational diabetes can be managed, first of all, by diet, again, looking at what they're eating, trying to reduce their carbohydrate intake, exercise, getting them to walk if their obstetrician is happy with that. There's 1 or 2 tablets that are safe in pregnancy that we can use. And then a minority will need insulin as well.
And is it safe for a pregnant woman to get insulin? Okay. Wow. I've never heard of this because I don't know. You see, that's why I really like us to have this conversation, because every time you come on Fauza's Diary, there is always a new revelation. I had no clue. I even thought that if you don't have any history of someone in your family who had diabetes, you may not have it, or you will, but it doesn't matter, especially, type 2. It's the way we live life. That is very scary, to be honest. So how do you now, as a doctor, right, typically diagnose diabetes?
So you take a history from the patient. You always start off by taking a history, how long have they been unwell? What symptoms have they had? And when it comes to diabetes, we're looking for certain symptoms. They may complain of increased thirst, drinking all the time, and just not feeling quenched. They may complain of going to the toilet frequently. You've probably heard of that.
Yeah.
And by frequently, I'll usually ask, do you wake up in the night to go to the toilet? And if someone is telling me they're waking up 2 or 3 times a night to go to the toilet, that's probably not normal. Some people can lose weight. If the diabetes is advanced, they can lose weight. We have some patients that will lose maybe 10 kilograms. So if you've been trying to diet for years and it hasn't worked, and then all of a sudden you start losing weight easily, just question that there's something going on. It's also, some people will have non-specific symptoms like feeling tired, just a lack of energy. They may not have the classic diabetes symptoms. They may just feel tired. And then the vast majority of people actually have no symptoms at all.
Oh, so how do you now as a doctor navigate that?
Well, so this is the work for public health. This is why we have things like Diabetes Awareness Month and Diabetes Day, and people can just get tested for free, depending on what your country is doing and what your region is doing, because there's actually a number of people out there that are undiagnosed, and you can't get treatment if you don't know you've got the illness.
Right.
So that's the important thing to remember, that it's one of those diseases that not everybody has symptoms. So if you're at risk of diabetes, if you have a family member, a parent, or a brother or sister with diabetes, I would suggest you get tested. If you are over the age of 40, I would suggest you get tested. If you've ever had gestational diabetes, which is diabetes in pregnancy, then you should really get tested annually, every year, for the rest of your life, because that gives you a risk. Certain ethnic backgrounds are more susceptible. So in this region, we're in the United Arab Emirates. So the cutoff for being tested for diabetes is earlier than the recommended 40. So you might get tested at 35, and it's just a simple fasting blood glucose. So it's worth getting tested.
Yes. Yeah, you had mentioned that in our previous conversation, and I really want to emphasize as well, because sometimes we are walking around with some diseases which can be taken care of, but because we don't know, we are just living, and then things happen, and then you're like, oh, but what did I miss? What signs did I not see? Or so really, I want to encourage each one of us, really just go get tested. And here in UAE, actually, I know in November, that's when they do the awareness and all that. So if you're in Dubai, you're in United Arab Emirates, just go get tested. It's free.
Especially if you're overweight or you're obese.
Yeah, it's free. Go get tested, you'll never know. You'll just never know. So now I want us to dive in more here, right? Is it even possible, Dr. Alero, to prevent diabetes if you have it in your family history? Because you see, for me, I always, before we started this recording, our chat offline, I always, in my little head, I always thought, oh no, if your family has no issues, then you are fine. But that's not the case, right? So how can you tell us, how can we prevent it if you have it, if the family history has a member or, who had or has diabetes?
Yes, so the first thing you can do is control your weight. If you're overweight or obese, try and lose some weight.
Let me stop you right there, Dr. Alero. So someone like me who is very tiny, am I safe?
No, you're not.
Okay.
You're not safe. So for you, Fauza, you could exercise more.
Okay, and I'm lazy, okay. Mm-hmm.
So, if you're overweight or obese, try and lose some weight.
Right.
Okay, control your diet, portion control, look at the portions you're taking, make sure your carb intake is the same as your protein intake, is the same as your salad intake. In this region and in, our country of origin in Africa, Nigeria, Kenya, people tend to eat a lot of carbohydrates and then a little bit of protein and a little bit of vegetables. So just try and, look at your portions, make sure that you've got an equal amount of the ugali or the eba and the vegetables and the protein.
I like my ugali.
That's why I mentioned it.
My ugali is the biggest portion on my plate. Please. Guilty.
You need to shrink the portion, Fauza.
Okay.
So control your diet, control your weight. The less fat you have on board, the less your risk of getting diabetes. Exercise is also extremely important, especially for people of normal weight, to prevent diabetes. So exercise, I mean, even when people are diagnosed with diabetes, this is the same advice we would give them. Control your weight, control your diet, exercise regularly. We would recommend as a minimum doing 30 minutes of walking, brisk walking, at least 5 times a day. That's a minimum. And you can start slow. You can start with 10 minutes, increase gradually to 20, 30. You know, we all have smartphones now that track, you know, how many steps you're doing a day. So make use of it, make use of it. Yes. So those are the things you can do to prevent diabetes. And also just, you know, staying aware. If you're at risk, get tested, because it's better to be caught earlier and, you know, sooner rather than later.
Yeah, yeah. Prevention is always better, isn't it?
Yeah.
But it's so, now you have just said something that made my bulb went like ting. But now, is it even possible to have diabetes and not even know it that I have it?
Yes. It's extremely possible. I mean, if you look at the data from the International Diabetes Federation, there's, you know, there's about 50%, then there's a certain number of people worldwide that have diabetes. Then there's another like 50% of that figure that are actually walking around with undiagnosed diabetes.
And they have no idea.
They have no idea.
And that's why I love you keep on emphasizing that we need to get checked, you know, we need to get checked. Thank you so much for reminding us on that. So what are the common complications related to diabetes then?
Well, this is leading on from the reason people should get checked and find out early that they have diabetes, because if you don't know, the damage is going on in the background and you're not even aware that you have it. So, I mean, I did some work in Nigeria a few years ago, and the doctors were telling me that a lot of their patients come in after they've already developed the complications of diabetes. So, you know, basically the high glucose levels in the blood damage the blood vessels, the arteries. So all the complications are as a result of this damage to the blood vessels. So, you know, the arteries to the heart will be damaged, and that can lead to a heart attack.
Yeah.
The arteries to the brain are affected. In the long term, that can lead to a stroke.
Yeah.
The arteries that supply the kidneys can be damaged, and diabetes is the #1 cause worldwide of end-stage kidney disease. So it's the #1 cause of people requiring dialysis, kidney dialysis. It can damage the arteries that supply the eyes. Diabetes is the #1 cause of blindness in the developed world. So when we say we want to diagnose it early, it's to prevent these problems, because a lot of this damage, where at the early stages, you don't know it's happening.
Yeah.
By the time it's the late stage, then it's already resulted in a heart attack or a stroke or blindness, which is why it's better to find
Get
out
checked.
that.
Yeah. Wow. It's actually very intense, you know, and I think having these conversations, it will enlighten people and really get serious, because I actually didn't realize that it has so much complications than we know. And if you don't know better, you don't do better, you don't think better. So why is this prevention then so important?
Well, as you said, prevention is better than cure.
That's right.
Because of the worldwide prevalence of diabetes, the way the rates are worldwide, the way the rates of diabetes are increasing, we are getting increasing risks of all the complications. So we have there's still blindness, we're going into 2022, and there are still people going blind from an illness, a disease that has a treatment. And when you have these complications like strokes, heart attacks, the rehabilitation that is needed, it costs so much money. It takes so much of the healthcare budget to care for people that have these complications from diabetes. And that money would be better directed in, assessing risk, early diagnosis.
Yeah.
And apart from the cost to healthcare, the cost to oneself of living with a stroke or managing post-heart attack, it's far better to prevent the diabetes in the first place. And if you can't, get diagnosed early and get the treatment and take the treatment regularly.
Yeah. Wow. Thank you so much for really insisting on that, because I think most people, they don't even know the repercussion, and what it looks like, to live without having that awareness of what's going on in your own body. So I want us to go into the future a little bit. We don't know what the future holds, right? But, we have to look into it somehow. So can you tell us a little bit more about some of the more advanced technologies in diabetes treatment? Because I know you've mentioned that you do research, you've done research, and there is always some new technologies and all that, but how does that really look like for people who are watching us now, who are so worried, maybe themselves or their family member? What can you tell them?
Yes, so the first thing I'll say about treating diabetes is education. Education is key. Explaining to the patient what they have, what has caused the diabetes, and how they can manage it themselves. This is really important. So everything I've explained to you, explaining to them why we want the glucose levels to be lower.
That's right.
So that they know that we're actually trying to prevent them having heart attacks, strokes, etc. So taking type 2 diabetes, we have oral medication. So that's tablets that they can take. But the first thing is educating them, getting them to change their lifestyle, look at their diet, exercise regularly. If that doesn't work, then we introduce the tablets and the oral medication. And we've got all sorts of different medication we can use. Some people are fine with one tablet. Some need 2, 3, 4, 5. And as I mentioned earlier, we also use insulin to treat type 2 diabetes. We also have treatment for type 1 diabetes, which is just insulin. Now, this insulin can be injected. If you have type 1 diabetes, you'll have a background insulin which works in between your food and whilst you're sleeping. And then you'll have another insulin, which is a rapid insulin. It works very quickly. And that works when you give that injection when you eat. So my patients with type 1 diabetes, they'll be on insulin injections at least 4 times a day.
What?
If they're having regular snacks, they may be taking injections 6, 7 times a day. Now, in terms of the future and what it's going to look like, at the moment, we have insulin pumps. So the patient just has a small device, which is about the size of a small mobile phone. And that device, the insulin is in there and it is connected to the body through a tube and a small needle that goes under the skin. And it constantly injects the insulin. Some of the pumps now, they can control it from their mobile phone. Some of them have remote controls. And the benefit of the pump is it gives the patients more flexibility.
Wow.
If you don't want to eat, you don't have to eat at a particular time. If you decide you want to exercise, you can just stop the insulin infusion from going in, so that when you exercise, your blood glucose is not dropping. Some of the pumps are attached to what we would call a sensor, a glucose monitoring sensor. And these sensors are little patches that you can attach to the skin. You've probably seen people around.
I have,
They
yeah.
have a little,
Whitish thing here. Yes, yeah.
yes, a
Yeah.
little dip attached to the skin. And
Yeah.
this, again, it has a small filament that goes into the skin and is measuring the blood glucose. There are different sensors. Some of them measure the blood glucose every 5 minutes. Some of them measure the blood glucose every minute. Again, they can connect with your mobile phone. And not only can it connect with your mobile phone, but you can actually share your result with other people. So you can imagine children who are at school with type 1 diabetes, their parents at home can look on their mobile and actually see what is happening with their child's blood glucose levels. So it's really revolutionized treatments of type 1 diabetes, because before these sensors, the patients had to do the finger prick testing. They had to do the finger prick testing, and it was quite painful. People, if you're frightened of needles, it wasn't a good option. So the technology for type 1 diabetes has come at a rapid pace over the last 10 years. And there's still a lot to come. I mean, companies like Apple and Google are trying to create non-invasive techniques. So someone can just wear an Apple Watch and that watch will be measuring their glucose. So if they are successful, that's going to be another big game changer.
Yes, can you
because
imagine?
now you don't need to have anything going in anywhere.
That's that right there is when what I call it, the power of how technology can actually change someone's life. Honestly, I think that is so fundamental, so beautiful to hear. And yeah, I'm just like, I actually didn't realize how much it is for diabetic patients to, that they go through all these things, Dr. Alero. But can you explain how these new diabetes technologies can reduce the risk of hyperglycemia and or hypoglycemia as well? How does this look like?
So when your blood glucose is being measured continuously by these sensors, you can set a sensor alarm. So you can set, so that you're notified of changes in your blood glucose. So hyperglycemia is when the blood glucose is high, and the sensor can alert an individual to let them know that their blood glucose is high, so that they can then give correction. Now we have pumps and sensors that talk to each other. Yeah. So the sensor just talks to the pump and says the blood glucose is high, you pump, give more insulin to bring the blood glucose down. And the patient can be happily asleep and doesn't have to wake up and do the injection themselves. Likewise, if the blood glucose is dropping low, that's what we call hypoglycemia. We don't want the sugar to be high, we don't want the sugar to be low. If the blood glucose is very low, the patient can actually slip into a coma. So low blood glucose is especially dangerous. Yeah. So now when the sensors are dropping, you can put in a certain level that you are alerted when the sensor has dropped to that level.
Okay.
And then again, you have so either you can be alerted so that you can eat a sweet or something to stop the blood glucose dropping further, or we also have sensors that talk to the pump and say, look, the blood glucose is dropping low, pump, suspend insulin, and the pump will stop giving the insulin.
Wow. Okay. That to me is really, it gives me hope for those who they have diabetes, because it's a continuous way of monitoring, and it's sort of, it becomes part of your lifestyle, Dr. Alero. So
I
what
mean,
is
you've got it right there, Fauza. We call them actually continuous glucose monitoring systems. So back in the days when the patients were doing the finger prick testing, they would do 5, 6, 7 tests a day. And that was a really good patient. That was a patient who was putting in a lot of effort. And
Yeah,
now you've got these continuous monitoring systems that are checking your blood glucose every 1 minute, every 5 minutes. And, before these systems were developed, the patient had to do all that thinking. They had to
yeah,
think about, what they're going to eat and how they're going to manage their exercise. And technology, it was quite stressful. It was
yeah,
quite a stressful thing for them. And now technology is taking away all those day-to-day decisions that these patients with type 1 diabetes were having to make.
yeah.
So it's a really good thing.
Yeah, it is. And also for you, for your patient, you've said that some of these new technologies have been happening for the last 10 years. So, and you have been in this for 2 decades. So that is, you have also witnessed the progress and, what's happening within this, with diabetes and all that. But I want us, our time is almost up, Dr. Alero, but I want us to tap into, let me put it together, the difference between an insulin pump and a continuous glucose monitoring. I think you've mentioned a bit about that. And what I've heard also, that CGM has allowed progress in the technology of artificial pancreas for management of patients with type 1, specific diabetes. Can you go a bit in there, please?
Yes. So, I mean, just to reiterate, an insulin pump, that's what it does. It has insulin in it, and it injects the insulin as a continuous infusion under the skin. When you eat, you can let the pump know, and it will give you more insulin to cover the food that you've eaten. If the sugar is high, the pump can give you more insulin to bring that sugar down. Now, the continuous glucose monitoring systems are to measure the blood glucose. So you have some patients, and what they do is just measure the blood glucose. They don't have any insulin, they just measure the blood glucose. You have some patients that use the majority of our patients with type 1 diabetes will be using insulin pens and insulin injections with a continuous glucose monitoring system. But then you have some of our pump patients, and some of the pumps now have integrated. They join together the pump and the continuous glucose monitoring system. And when you join that together, so that the glucose is being measured, the result is being communicated to the pump. The pump is then able to give insulin based on that is what you call artificial pancreas.
Wow.
Artificial pancreas. So
That is
again,
technology. There is just a lot of technology here, Dr. Alero.
yes.
What is the UAE doing in the fight against diabetes, and where do you see this going? Because I know here they're very intentional. Like, since I've been here for a decade plus, every year I know there is awareness, there are walks that they happen, testings and all those things. So, but how does this look like now and in the future, looking at you are here practicing here?
So the UAE is doing a lot. I mean, they're in a position where they have this diabetes, which is affecting a huge number of the population.
Right.
They've got one of the highest rates of diabetes in the world. So it is in their best interest to try and tackle the disease. So they're doing a lot in terms of public awareness. In Dubai, we have the 30 by 30 challenge, which is 30 days of at least 30 minutes of exercise. When you go all over Dubai, there's some sort of exercise, free activities going on. There's a lot of general raising of awareness. There's a lot of walks, bicycle rides. A lot of hospitals offer free testing during the month of November. All you need to do is go in there having fasted, so not eating or drinking anything but water for at
No
least
gali. Just tell me no gali.
no gali, no gali for at least 8 hours, and then you do your blood test. They're also pumping a lot of money into the health economy in general. They're creating medical schools, research facilities. Where I work, there's a lot of research going on into type 2 diabetes and type 1 diabetes and genetic diabetes, which we haven't even touched on.
Mm-hmm.
So the UAE is doing its fair share in tackling this illness.
Yeah, because can you imagine living with diabetes sometimes for someone who can't even afford to have a meal on its own? It's very risky, actually. When you think about it, it's very dangerous.
Yeah.
Wow. Thank you so much for sharing your knowledge with us on Fauza's Diary. I would love for you to give your last thoughts to someone who is losing hope because they have just discovered or they have been diagnosed with diabetes and they are losing hope already, or they don't even know what to do. There is panic everywhere. What would you tell that person?
Yeah, I think that's an important point. I think, first of all, they need to try and accept the diagnosis. They can't handle it until they have actually accepted it.
Mm-hmm.
And they need to think about why they're struggling to come to terms with the diagnosis.
Mm-hmm.
It's not their fault. It's never anyone's fault when they get an illness. It's just something that's happened to them.
Yeah.
And they should be pleased that they know they have it, and that gives them a chance to actually do something about it. I think diabetes, I tell my patients, if you look after your diabetes, it will look after you.
Oh.
If you if you are careful with your diet because you know that it's going to affect your diabetes, if you do regular exercise because you know that's going to help your diabetes, if you take any medication you've been prescribed regularly, then the diabetes will look after you. And there's no reason why you shouldn't have a fulfilled life, live long without any complications. If you don't look after your diabetes, then that's another story. But with diabetes, if you look after it, it will look after you.
Oh, what a beautiful way to end our conversation today, Dr. Alero. If you look after your diabetes, it will look after you. That is so encouraging and inspiring because, we are human beings. I know you are sitting there as a doctor, but for me on this other side of the screen, I'm like, wait, what did she say? Because in my mind, I visualize a lot. I'm like, how does that really look like? But that's so beautiful to encourage all of us. But I also want to remind us, Dr. Alero has actually emphasized so much, not just on this conversation, but even the previous one I've had with her before, that we need to be intentional. We need to move around. Don't be lazy. Mind if you like ugali. Okay, so for those who they don't even know what ugali is, we've talked a lot about it in the show, is what is maize meal. It's meal, yeah, and then it's made, it becomes a bit harder like a dough, and that's what we eat in most part of Africa. So that's seriously our staple food. And most of the time when you are hungry, the portion gets really big, and maybe a little bit of kale or cabbage and a little bit of meat if you can afford to have meat. So you can just imagine it's not even balanced, right? So let us be mindful of that. Let us get tested. If you're in Dubai, in UAE, I want to encourage you, go get tested. November is the month of awareness. It's for free everywhere. You can get it done for free. So there is no reason why you can't get it done, because you're not going to pay for it anyway, right? Okay, Dr. Alero, as usual, I'm so grateful, Sisi, for having this conversation with me. Is there anything else you want to add?
No, get tested.
Oh, the doctor has said, get tested. Like, seriously, go get tested. Okay, thank you so much for joining me, Dr. Alero, on another conversation on Fauza's Diary. And for you, my viewers, go get tested. Walk, okay? This isn't a joke. If you sit and listen to what Dr. Alero has said, you want to be sure of what's going on in your own body, okay? And for those who have been diagnosed with diabetes, if you look after your diabetes, it's gonna look after you, right? Don't forget to share this conversation, because you'll never know who might need this encouragement and also all the free knowledge Dr. Alero has given us. I call it free consultation, yo, right? So you should thank me for having her on my diaries, right? Okay, share, subscribe, and I will see you guys soon with another inspiring conversation just like this. Go get tested, and I will see you soon with another inspiring conversation. Be safe.